A part of my job as a pulmonologist is to help patients when they have abnormal CT scans. One of the main things that people can get when they get a CT scan of their lungs that shows up is a spot in their lungs called a nodule. Nodules can be can create a lot of anxiety for patients because when they have spots in their lungs, we and patients worry about cancer. Some nodules are too small to biopsy, but other nodules we have to biopsy to determine if there's cancer or not. This tool allows us to go after almost any nodule in the lung to try to provide patients with diagnostic certainty. When we can give patients diagnoses, we can alleviate some of their anxiety and/or we can make treatment decisions to help take care of whatever the problem is. So this is just the first part of the procedure where the robot kind of matches where we are in the patient to where it thinks we are with respect to the CT scan that they've had before the procedure. I mean, the little green ball on the left is where I can see you have a right and a left lung. And then as you go into the left, it splits again and again and again, and it's the same on the right. It's kind of like branches on a tree, where if you think about you have the trunk and then you have a couple branches and a few more branches and a few more branches. The robot is thin, so it can actually get to a lot more branches than we currently can with our current bronchoscopes. The robot helps with the navigation out to where we're going and tries to get us in the right spot, and then we use additional tools to confirm that we're in the right spot. And then once I drive out to the spot, I can put my tools in and biopsy the spot and try to get an answer. And so this allows us to, one, get to the nodules that radiology could not otherwise get to. Two, biopsy nodules from the inside, which has a much lower risk of lung collapse that radiology may have not wanted to do in the first place. Or three, for really suspicious nodules, allow us to do both diagnosis and staging at the same time. So then when I put the needle in, like I set my needle length based off this.
Do you know where you're going? Like which one you want?
So the blue line, it's like, you want to play it? I see this as as the future. There are other things that we will be able to do with this to facilitate better outcomes from surgery. We can put markers in to help the surgeon cut out less of the lung than we would traditionally. There may or may not in the future be ways that we can treat lung cancer from the inside without having to send patients to radiation or surgery. The results that I expect to see with this robot should be able to give almost all patients answers with respect to what's going on inside their lungs.